Hello, everyone. This is Suzanne. I just want to tell you how much I appreciate you joining us today for the live cast. So today what we're going to do is we're going to talk about the Medicare Supplement versus Medicare Advantage. But before we get started, I would like to introduce a few people here that's here with us today. I know many of you, when you call in, you talk to Alice and Ty and Joe and Tisha. And I asked a couple of them just to jump on for a few minutes just to say hi. So when you call in, you know exactly who you're talking to because it's very easy once you see a face with a name. So I'm going to go ahead and just let Ty jump in and say hello to everyone, just so you can definitely put a face with the name. So Ty, go ahead, bud.
Hey, everybody. Nice to see you all here. Glad to see we have a great audience today. And I'm sure a lot of you spoke to me. And I look forward to the live cast we have today with Suzanne.
Okay, and now Alice Harlow, many of you have talked with her. She's been with me for quite some time. So I want to go ahead and let Alice jump in and say hello.
Hi, everyone. I'm so glad you guys were able to join in our live cast today. And if you've got any questions, just give us a call. We look forward to it.
Thank you. And of course, last but not least, Joe McLean. He's my husband, my better half. And he and I today are going to do this live cast together. So he'll be, we're going to do this a little bit different, almost where he's asking me questions and I'm going to be answering those questions. So I'm going to go ahead and turn it over to Joe.
Hey, everybody. Thanks for being here. So great to have you. And yeah, this is going to be a fun interaction between Suzanne and I, back and forth interview style. And like she said, I'm going to ask the questions. She's going to answer them. And being married to her, I can tell you for sure she has an answer for everything. So let's get started.
Okay. So I will tell you this, that pretty much every open enrollment, I will get phone calls and the phone calls will start like this. Hey, Suzanne, I'm not sure. Should I be switching to Medicare Advantage from my Medicare Supplement, or should I be switching from my Medicare Supplement to Advantage and vice versa? And we get those questions all the time. So really what I thought I'd do is just jump on here, answer a lot of the questions that you may have. Just kind of give you some feedback. So I'm going to go ahead, turn it over to Joe, and he can start off with the questions.
Right. So, like the title of the live cast says today, like, is it ever smart to move from an advantage to supplement or supplement to advantage? And we're going to take into account that we probably have some people here today that's just getting ready to retire and haven't even chose one over the other yet. So we want to kind of address maybe some concerns you have too of getting started. Is it better to start with one or the other? Or change at some point down the road. So another thing I wanted to point out before we jump right into this is our live event. So we have talked about this over the last couple of months. Our live event coming up on Thursday, May 2nd. It's from 11 a.m. to about 3, and we're serving lunch. It's going to be a great time. We're bringing in a nationally known speaker, Richard Leiter. He has written several books on the power of having purpose in your life. And the title of the event is How to Add 7 Years to Your Life Without a Gym Membership. And that's kind of like tongue in cheek, but there is a lot of truth to it and there's science behind it. We're very excited to have him come tell us how to do that because we're all excited. We're all interested in adding length to our life, but we're also, want to have a fulfilled life while we're doing that. Uh, and we're also having this year, if you came last year, we have like more of a treat for you because Suzanne's going to do a little bit more presenting live. So we heard from the reviews last year that you guys love Suzanne and you love to hear from her. So she's going to be on stage more this year and it's going to be a great time. We're serving a great lunch and Ty or Alice are going to put in the chat the link to go get your ticket. It's only $10. And yeah, it's going to be a great time. So let's jump right into the supplement versus advantage. And Suzanne, just give like the base, if you could give like a basic rundown of like what the supplement is and what the advantage plan is, and then we'll take it from there.
Great. So As many of you know, you've probably already met with myself or Tisha, and you've either signed up for Medicare Supplement or Medicare Advantage. So I like to kind of explain, really, it's completely different. You cannot compare, really, it's apples and oranges when you're looking at Medicare Supplement versus Medicare Advantage. So let's just go down the Medicare Supplement route real quick. So basically, the way that your Medicare Supplement would work is you would have your Medicare Part A and B card, your red, white, and blue card. And with that Medicare card, you would present that at your doctors and your hospitals as your primary insurance. And then your supplemental insurance, which would be with the insurance company, Anthem, Aetna, whatever company that we put you with, that Medicare Supplement card then pays as your secondary. So your primary is Medicare, your Medicare Supplement is your secondary. Most of the plans that we recommend to ones have a very little deductible. So you basically have a small deductible. And then, of course, as long as Medicare pays their portion of the claim, your supplement pays your portion of the claim. Of course, the supplements do not cover pharmacy, which is your Medicare Part D. So we do have to put a separate Medicare Part D plan and kind of marry it together. And it could even be two separate companies. We might have Anthem for your supplement and Humana for your prescription drugs, because we don't have to have the same insurance company because it's two completely different plans. So the way that your supplement would work is you will be allowed to visit any doctor, any hospital, or any facility that takes and accepts Medicare. So you really don't have a network, so to speak. As long as they take Medicare, they're going to take your supplemental insurance. But with the supplemental insurance, they don't give you the extra benefits like the dental, the vision, the hearing, the over-the-counter products. They strictly go with your supplement piggybacks Medicare. So as long as Medicare covers the claim, then your supplemental insurance is going to kick in and pay your cost. So many of you, I use the analogy, your Medicare Part A and B kind of reminds me of like a piece of Swiss cheese, because it has coverage, but there's a lot of holes in that coverage. And that supplemental insurance plan kicks in and fills most of those holes of that Swiss cheese, fills the holes on the Part A side, which is your inpatient care, and fills most all the holes on the Part B side, which is your outpatient care. So with your Medicare Supplement, you do pay a higher monthly cost. So you might, of course, you have a wide age range here. You might have, 65-year-olds, I might have 80-year-olds. So you are paying a monthly premium for that Medicare Supplement. However, your out-of-pocket exposure is very low because that supplement kicks in and fills those holes of that Swiss cheese per se. So that would be your Medicare Supplement. And of course, you have the flexibility to go to any doctor, any hospital that takes Medicare. Now, the Medicare Advantage works completely different. Now, these are typically the advertisements you see on television, even like some of the flyers you get in the mail that says, buy this plan for a $0 cost. And the call I get is, Suzanne, is this a scam? Because how do you get something for nothing? Here, especially here in Ohio, there are so many plans that are a zero premium plan. How can I get free dental, free vision, free hearing? Even some plans have grocery benefits or over-the-counter products. How can I get that for a low or zero premium? Let me explain how this plan works. So you have to have your Medicare A and B. So you're still paying that Part B premium that comes out of your Social Security check. So you have to have the Part A and B in order to get into a Medicare Advantage plan. But here's how your Medicare Advantage plan works. So the government collects the Part B premium. They add funds to it. So the government's adding funds to that premium. And then whatever Medicare Advantage company that you decide to go with, whether it be Anthem or Aetna or Medigold or, well, there's a lot of them. Whatever one you decide to go with, at that point, what happens is the government pays that insurance company every month to administer your benefits. So therefore, that insurance company is kind of setting up the rules, and they're saying, okay, well, if you buy our plan or you enroll in our plan, this is what the monthly cost is going to be. Like I said, here locally, there's so many zero premium plans. But what they also do is they say, okay, now here is our list of doctors or hospitals. Now it's totally fine, but if you're going to go into Medicare Advantage, you want to make sure that your doctors and your hospitals accept that plan so you can get the best coverage for the plan. So you want to make sure that you stay in the network if you go with those plans. Now they do offer, the extra, maybe a couple of visits to the dentist and so much dental, so much vision, hearing, over the counter. They throw in some extra benefits, but on the medical side, so now we're talking hospital side, doctors, x-rays, CAT scans, MRIs, those things typically have a copay that you have to pay or a co-insurance. So the premium is low, but with the premium being low, what you're doing is you're picking up the liability of, if you had to go into the hospital, you would say, hey, I'm willing to accept responsibility for so much of that hospital stay. Or you're saying, I'm willing to pay copays every time I go to physical therapy. So as you can see, the premium is low because you are assuming a higher liability on the medical side. Yes, they are giving you, some additional dental, vision, and hearing, which traditional Medicare does not cover. So if the traditional Medicare does not cover it, your Medicare supplement would not cover it. So you can see the difference. Your Advantage plan has your networks of doctors and hospitals that they want you to stay in for you to get the best coverage, or the best cost, I guess, for your coverage. But so they have the network they want you to stay in, but you are assuming a higher out-of-pocket liability if something happens. Now, one of the nice benefits of Medicare Advantage is they do have a maximum out-of-pocket. So all of the Medicare Advantage plans that's out there, they do have a maximum. So for example, now the spread is pretty large because it depends on what type of plan you go with. For example, one of the HMO plans that are around here, if you was to go on that HMO, which HMO stands for, you have to stay in network unless it's a medical emergency. So you have to stay in network or you would have no coverage. So the HMO plans, there's some that have like a $3,500 out of pocket, which means the most you would pay is $3,500, but you would be liable for up to the $3,500 in that example. Now, some plans are a PPO plan, which means you have your network of doctors and hospitals that they want you to stay within because they can control the cost if you stay in network. So as long as you stay in network, it's a lower out of pocket. But with a PPO plan, they do have the ability to go outside of that network. So let's say that you're traveling to Florida and you get sick and you want to go see a doctor, but it's not an emergency, so to speak. With a PPO plan, you can go to that doctor or that hospital if it's not really an emergency, just to maybe get treatment, but you would be considered in some cases out of network, where you are paying more money to see an out of network provider. And sometimes what I'm seeing is those out of network max out of pockets could go up to $6,000, $7,000, $8,000, $9,000, $10,000. So you can see the difference. So the Medicare Advantage plan throws in some extra benefits, the dental, the vision, the hearing. Those are the ads you see on television. The Medicare Supplement, more expensive, but it has typically more comprehensive coverage and the flexibility to use any doctor or any hospital. So those are the things when you're comparing which one makes the most sense for me, those are the things you really have to dig in and look at and say, what is the health care coverage? Because that's really what most people are very interested in, really knowing the depth of that.
Okay, Suzanne, good explanation. But I wanted to circle back to one thing that you were talking about with the dental, vision, and hearing on the Advantage plan. So like, I'm sure Ty and Alice can relate here, but we get a lot of questions during annual enrollment because people are seeing all the television commercials that are talking about certain plans, but really all they key in on is the dental, vision, and hearing benefits, these added benefits. So what I'm hearing you say is there's a major trade-off when you go with an Advantage plan with that dental, vision, and hearing versus the supplement that has more comprehensive medical coverage. Do you have any? So if somebody is calling us during annual enrollment and they're seeing all these commercials and they're on a Medicare supplement right at that moment, can you just talk to that type of person and what you would say to them, whether it's a good idea to switch to an Advantage plan for those benefits?
Yeah, that's a great question. And like I said before, we get that call quite often during the open enrollment. And typically the call goes something like this. Hey, Suzanne, I'm on a Medicare supplement. I'm seeing these ads on TV for the free dental, free vision, free hearing. Does my plan have that? Or what can you tell me? And I kind of go back through just what we just talked about is the Medicare Advantage plans, they're trading off the medical coverage. So what is important to you as the consumer? Are you willing to pay more per month to have more comprehensive coverage and then just buy a dental and vision plan separately? Or are you the kind of person that says, you know what, I'm willing to take my risk. I'm willing to assume a higher potential liability, and I'm willing to stay in the network because I want these extra added benefits of the dental, the vision, and the hearing. And I clearly explain that to you because you're going from they're completely two different type of policies, two different type of plans. Let me give you this analogy. And most of you probably, we've done this when we had our initial conversation. So think of a ladder. So think of your ladder. I'm a visual person. You guys all know that. So think of your ladder. At the top of a ladder would be your Medicare supplemental insurance, because really you can't get more comprehensive than a supplemental insurance. So at the top of the ladder is your supplemental insurance. Down the ladder would be a Medicare Advantage plan. Now, let me explain why. Because a Medicare Advantage plan being down the ladder means that you are assuming a higher liability for your medical coverage. So when you are just turning 65 or you're just going on Medicare for the first time, you have the choice to pick a Medicare supplement or Medicare Advantage, regardless of your health. But let's say, for example, that you go with a Medicare supplement here at the top. And as you age, let's say at 75 years old, because we all know that unfortunately premiums go up as you age. Let's say at 75 years old, you say, hey, Suzanne, I'm just not so sure I can afford the Medicare supplement anymore. Can I move down to a Medicare Advantage? Because now I don't have the income to pay my premiums, and now I'm willing to accept a higher liability. So here's what we can do. During the open enrollment period, you can always move down to a Medicare Advantage plan, regardless of your health. Okay. But let's say, for example, that you start with a Medicare Advantage plan. So remember the ladder, supplements up here, Medicare Advantage is here. Let's say you start with a Medicare Advantage, and 2 years from now, you call me up and you say, hey, my doctor just said that I need my hip replaced. I want to move up to a Medicare supplement. If you've been on that Medicare Advantage plan longer than 12 months from your Part A effective date, then you have to medically qualify to climb up that ladder to a Medicare supplement. So this is exactly the explanation that I give people when they call me at open enrollment and say, should I move from a Medicare supplement to Medicare Advantage, or should I move from Medicare Advantage to Medicare supplement? What's the rules? That's exactly my explanation. So those are great questions.
Okay, that's good stuff. So we had a question come in that kind of fits right here. So I'm going to ask it now. And that question was, can you have a Medicare supplement and a Medicare Advantage plan?
No,
So it covers.
No, you cannot have both, because remember, your Medicare supplement, Medicare pays your bill first at the doctor's office or the hospital, and then your supplemental kicks in and pays your cost. On a Medicare Advantage plan, remember, the government is paying the Advantage company to administer your claims. So if you are on a Medicare Advantage plan and they send your claim over to Medicare, Medicare is going to deny the claim, because Medicare is going to say, well, we're paying that Advantage company to administer their claims. Do you have any other questions?
Okay, yeah. So I think that was a good question, because a lot of people might not understand that you can only have one or the other. So I think a good follow-up to that is, are there any other like misconceptions that people have that you hear a lot that maybe you can cover right here? Like, I guess I don't even know what they would be, but do you hear anything where people commonly misunderstand a certain aspect of an Advantage plan or a supplement?
So another question that we get at pretty much every open enrollment is, someone will call me up and say, hey, Suzanne, I signed up for Medicare Advantage when I was 65, but I know it's open enrollment. Can I move up to a supplement? Because now I am willing to pay more, or I know my health is starting to deteriorate and I want to make sure that I have that coverage. But it's open enrollment. Can I go ahead and do that without having to medically qualify? And the answer to that is no, that's not the case. Is if you have been on that Advantage plan longer than 12 months from your Part A date, and we try to move you to a Medicare supplement, unfortunately, we have to put you through medical underwriting, where they pull your medical records. And of course, the insurance company can either decline you, or they can accept you and give you a rate up if they find something on your medical record. Now, there's a couple caveats to that, and I want to make sure I address that. So one thing the government does allow is, let's say that you started on a Medicare supplement and you've never been on a Medicare Advantage. So you started on a Medicare supplement and you say, hey, you know what? I just want to try out a Medicare Advantage plan. You have one time that you're allowed to leave your supplemental insurance, move to an Advantage plan, try that out for 12 months. And if you don't like it, you can go right back to your supplement regardless of your health. There is a one-time shot. It's called a trial period. So I don't want to tell you you never can do something like that, because there is a couple of situations where they're called trial periods that you are allowed to do certain things, such as that exact thing. You were never on a Medicare Advantage plan. You were on a Medicare supplement at the beginning. You want to try out an Advantage. As long as you're on that Advantage less, or 12 months or less, then you can go back to your supplemental regardless of your health. So that's another question I get a lot during open enrollment. What am I allowed to do? And those are the explanations.
So that's good. So we're getting some great questions coming in, and I'm kind of taking them out of order as they apply to what Suzanne's talking about. So we're getting to all of these. So I don't want you to feel like we're missing your question. Anyway, Suzanne, so another good question. It goes right along with that. It comes in, and what about staying just on original Medicare, your Medicare A and B, and not picking an Advantage plan or a supplement? What's the downsides or upsides to that?
Well, to be very honest with you, I don't see an upside to it at all. And here's why. If you go with traditional Medicare, just your Part A and just your Part B, the downside of not having a supplemental or an Advantage is you do not have that maximum out of pocket that you like. It's kind of like a cap. So let me give you an example. So let's say that you just have Medicare Part A and Part B. God forbid this happened to you and you get cancer and you go in for chemotherapy. You and I all know that chemotherapy is a pretty expensive process. So chemotherapy, radiation goes under Part B of Medicare. B as in boy. Okay. So if you only have the Medicare Part A and the Medicare Part B, you go in for chemo and radiation, Medicare pays 80%. You pay, or you're responsible for 20%. So let's say you go in and you have radiation 4 times a month, just giving you an example. and these are just example purposes. Let's say that each treatment cost, let's say $20,000. Just to give you an example. Okay. $20,000, Medicare pays 80%, you're responsible for 20%. Well, if you're paying 20%, that's a lot of money 4 times a month, right? So with traditional Medicare, it does not have a maximum or a ceiling of what you are responsible for. So the sky's the limit. You're paying 20% of whatever the bill is on the Part B side. So with the Medicare supplement, remember that kicks in and pays or fills those holes of that Swiss cheese for you. So it protects you. It protects your assets. It protects you as a person. Medicare Advantage, if you have Medicare Advantage, the benefit of the Advantage is all of those plans, just like I spoke before, they do have that maximum or cap out of pocket. So at least, even if that cap is 5,000 or 8,000 or 10,000, depending on what plan you're on, at least it has a maximum that you're liable for. So I tell clients, this is my professional opinion, is you need something, whether it be an Advantage plan or a supplement, depending on your financial situation, you need something to where at least you have a maximum liability. So hopefully that answered that question. Long way around to answer that question.
Okay, another good question is, do the insurance costs, the out-of-pocket costs differ on a supplement state by state?
They do. They absolutely differ state by state. So we are licensed in multiple states. So if you're, on this, from Florida or Texas or Kentucky or whatever, when we do your presentation or the meeting with you, we obviously have to sell you or enroll you in whatever state in which you reside. Now, that is a great point, because a lot of clients, are here in Ohio and then they move once they retire. So they might move to Florida, or they might move out west or Arizona or whatever, really because Ohio's cold in the winter and they want to go somewhere warm. Totally makes sense. Your supplemental insurance plans are portable. So basically what that means is if you're currently on a supplemental insurance and you move to another state, that supplemental is a portable plan. So it can go with you. Yes, the rates will change, because what they're going to do is they're going to change your rate to a higher Ohio rate, but let you take that with you. Okay. Now, Medicare Advantage plans are not portable. So when you sign up for a Medicare Advantage plan and you enroll in that plan, we're going off of what county you currently reside in. So if you reside in Franklin County, you're enrolling in a Franklin County plan. But let's say that you move to Florida. As soon as you make your address change with Social Security, what's going to happen is you're going to get a letter in the mail from whatever your Advantage company is, and they're going to say, you just moved out of the service area. You need to now pick a plan in that county, and your current plan is going to terminate XYZ date. So the Medicare Advantage plans, as well as the pharmacy plans, are not portable. You have to purchase those in the state in which you move in the county, because those plans are all county specific.
Okay, Suzanne, I don't want to get too far ahead of ourselves with this question. So, but I did want to hit it here. So Bob sends it in. He's on a Medicare supplement, and he asked, if you're healthy, is it wise to move to an Advantage plan? So maybe you can just hit the high point there, because I know we want to circle kind of back around at the end when we talk about situations where it makes sense to move from one plan to another. So just hit that real quick for Bob.
So that's a great question, Bob. And I get that question often too. And I always say insurance is a gamble. So if you're on a Medicare supplement now and you say, hey, I want to go try out the Medicare Advantage plan, remember you have one shot to do that. And you're only allowed to do that for up to 12 months. So you could leave your supplement, move to an Advantage. You only have 12 months to get back. So what you need to think about is, what kind of person are you? And that's really what I put out to people that are healthy. Are you the kind of person that wants a budget, and you want to say, okay, every single month, this has to come out of my account because I know I want this peace of mind. I want to know I can go to any doctor, any hospital that takes Medicare. I don't want to have the worry of, if God forbid I had something catastrophic happen, of, oh, I don't want to go to the hospital, or I don't want to go to the doctor because I don't want to be liable for that big out-of-pocket cost. So really, you just have to kind of take it inside and say, what type of person am I and how do I handle it? Because I had a person that one of my clients, bless her heart, she left her Medicare supplement. She went to Medicare Advantage plan, and she worried and worried and worried and worried. If something happens to me, I don't want to be responsible for that out-of-pocket cost. But she wanted to try it out. Now, in her case, thankfully, nothing happened. But she came back and said, okay, move me back to the supplement, because she was a person that she needed the peace of mind of knowing I'm paying every single month, but I have the peace of mind if something happens, I can go to the doctor or hospital and not have to worry. So that's kind of example. It's hard, like in my opinion, it's harder when you're healthy to make these decisions, because you really don't know what possibly is going to happen to you. I always kind of liken it to the analogy: you pay for homeowners insurance every single month you pay, but you really hope you never have to use it and your house burned down, right? So I almost look at it as health insurance. If you're somebody that's healthy and you're really not a user, you kind of got to say, what type of person am I? Am I willing to take the risk, or am I somebody that says, I really just want to pay the payment every month and know in the back of my mind I have the more comprehensive coverage?
That's good. So we have a lot of great questions coming in here. I appreciate it. Keep them coming. The next one that kind of goes with the previous question was, if you move to another state, does your payment change to align with the new state's cost? Must you move your Ohio plan and pay that potentially higher cost, or change the plan to one in that state with a lower cost? So if you could just speak to that for a minute.
That's a great question too. So most people will take the Ohio plan with them. And basically what happens is the insurance companies here in Ohio just move you to the highest rated area in the state of Ohio. Because believe it or not, Ohio is a cheaper state for supplemental insurance. So like, let's say, for example, you went down to Florida. You are definitely paying a higher rate for a Medicare supplement if you go in as a Florida resident. So most of my clients, and I've had a lot of clients that have moved from Ohio to Florida, they pull that Ohio policy with them, because even though it bumps the rate up to the higher Ohio rate, in most cases, it's still significantly cheaper than like a Florida rate. So now if you get to that point and you want to research it and you move, give us a call and we'll be more than happy to go through and see what makes sense for your situation. But that's a great question.
Yeah, it's a good question. So speak to it. If they're on an Advantage plan in Ohio and they move to another state, how does that work?
So Advantage plans, once again, if you're on an Ohio Advantage plan, as soon as you change your address with Social Security is going to tell whatever Advantage company you're with, Anthem, Aetna, Humana, Medigold, whoever you're with. They're going to tell that Advantage company, hey, he moved out of the service area, or she moved out of the service area. Here's their new address. You're going to get a letter in the mail from your current Medicare Advantage company that says, you've moved out of the area, you need to pick a new plan and your insurance is terminating. So once again, if you're in that situation where you decide to move out of state, totally fine. Hopefully you're moving somewhere warm. All you got to do is give us a call and say, hey, Suzanne, we're moving to Florida, we're moving to Arizona, we're moving to Tennessee, North Carolina, et cetera. What do you have available? And what we'll do is, if you're on Medicare Advantage, we'll just hook you up on a Medicare Advantage plan in that area.
It's good. So next question that I want to cover is based on a veteran. So if you're a veteran and receive your care through the VA system, how does that influence your choice between supplement and Advantage plan?
These are some good questions. So VA is tricky because basically the way it works generally on the VA side is you go to the VA, they take care of you. right? Here's where when veterans come to me and they say, well, Suzanne, what should I do? Okay. I personally, just from what I've heard from other clients, what I typically hear is, I'm a veteran, I have the VA option, but I really want the flexibility to be able to go over here to Mount Carmel or go to Ohio Health or go to Ohio State or just stop over to CVS and pick up my medications, for example. And then I do is just go through the same thing, Medicare Supplement versus Medicare Advantage. What makes sense for you? Now, here's really the reason why most people will choose one of those plans besides just staying with the VA. This is just what people have told, clients have told me, is let's say you go to the VA and they say, okay, you need a hip replaced. I'm just giving you an example. And the VA might say, okay, well, we can get you in for a hip replacement in 5 months. I'm just giving you an example. And the VA hospital might be 30, 40 minutes from your home. You might say, well, I really don't want to wait 3, 4, 5 months till they can get me in. I'd rather go to the local hospital here and have my hip replaced. Or I'd rather go to a facility closer to my home. And that's what I typically see once they go ahead and do this Medicare Supplement or the Medicare Advantage, because they want that flexibility outside of the VA. Now, I've had clients call me and say, I go to the VA for everything. I love them. That's where I'm going to have my work done. But just in case, I want something. And a lot of times they'll do an Advantage plan because Advantage plans are obviously cheaper and they're really only using that for an emergency backup. The other VA people that come to me and they say, I have the VA, but I definitely want something else and I'm willing to pay because I want the flexibility to go to any other hospital, they may take the Medicare supplemental. Great questions.
Okay, good. So Dale sends this in. He said, my mother is 101, and lives in a nursing home that does not take her insurance. What can we do? Can you speak to that real quick?
Well, that question has a lot of pieces to it because A, I need to know what state she's in. B, I need to know what type of insurance that she has. Now, being in a nursing facility does give you what we call a special election period where you can potentially make plan changes other times than just open enrollment. So Dale, you might want to give me a call and maybe we can set up an actual conversation about her unique situation. But that's awesome that she's 101 years old. That's amazing.
Yeah.
But needless to say, maybe give me a call and let's dig into her particular situation and let's see what we can come up with.
Okay, good. So another question is, so this sounds like somebody that is comparing Advantage plans versus Supplement. So on the Advantage plan, they get the dental, vision, hearing. So this person asks, how cost effective are vision and dental plans? Are they really costly like Cobra or more reasonable? And I would assume this is somebody that wants to add it because they have a Medicare supplement.
Well, I'm going to put Alice on the spot here, and she does not know I'm doing this. She's the one that handles the dental and the vision here at Numa. And I have told her, you figure these dental and vision plans out and get your head wrapped around it because I have to know Medicare. I need you to know dental and vision for sure. So I'm going to let Alice go ahead.
Yeah, I'm going to jump in there and I'm not going to put Alice on the spot because she don't like that. But what I will tell you is Alice loves helping people with their dental and vision. And so people that have a Medicare supplement, or if you're thinking about a Medicare supplement, but want to know how much the dental and vision part of it is going to cost, the extra, then just give our office a call. Alice would love to meet with you and go through all the different choices you have and help you figure that out. So I'm not going to put Alice on the spot right now. So Suzanne, going through some other good questions here. Another one is, does a Medicare supplement plan cover overage costs for physical therapy?
So you have to remember that the way the Medicare supplement plans work is they always piggyback Medicare. So if Medicare has cut off physical therapy, then your Medicare supplement is going to cut that off, because your Medicare supplement is only going to pay after Medicare pays. So like, here's an example. I had a client that every single year he wanted to get a colonoscopy done. And there was no reason. Like, he didn't have health issues, but he was very nervous. And every year he wanted that colonoscopy. And thankfully, every year when he had it, he didn't have any issues. With that being said, Medicare does not cover a colonoscopy every single year unless you have a medical condition where they're looking for something or they found things in the past. So he and I had a conversation. He called me and he said, well, Suzanne, I got this bill for my colonoscopy. Why didn't Medicare cover it? I started digging into it. And sure enough, I found out because it was every year he was wanting to have it. So what you have to think about is, if Medicare does not pay, the supplement is not going to pay. So that's what you got to think about. It's not the insurance company making that decision. It's not the supplement plan making that decision. It is the Medicare that's making that decision. Yes, it's covered, or no, it's not. So back to the physical therapy. If Medicare has said, we're done paying, then that supplement is not going to cover. That's a great question.
Hey, Suzanne. So I think something that's would be really helpful is, like, obviously it is a very using the term advantage and the term supplement are two very different things. If you could just do, like, I know we didn't really talk about this ahead of time, but like a one sentence definition of supplement and a one sentence definition of advantage plan, I think that would be really helpful, because we have clients that'll call in occasionally and kind of use the terms like interchangeably, because you think supplement, well, that's on top of my Medicare. So they kind of use the word supplement for the extra plan they have that covers things. So they might use supplement when they really mean they have an advantage plan. So does that make sense to just give like a one sentence definition of each, or is that?
I can try. I have lots of words, so one sentence is tough. With that being said, if you're paying a monthly premium to an insurance company and you have a separate prescription drug card, then you're on a supplement. So really you have 3 cards: your Medicare card, your supplement card, whatever company that is, and your pharmacy card. So if you have 3 cards and you're paying different bills, you're then on a supplement. If you have a Advantage plan, typically those plans are a $0 cost, most of them. There's a lot here in Ohio that's $0. So if you're not really paying a premium, and if you pull your card out and if your card says HMO or PPO, that means you have a Medicare Advantage. That's longer than a sentence, right? Sorry. That's an explanation, though.
Yeah, that's a good one. I like what you said. I have lots of words, so it's hard to keep this to a sentence. So anyway, let's move along here. Anybody else has any other questions, put them in the chat. I'm going to go through the last few questions that I have, and to try to get a better, so we can really drill down on people that are thinking about switching. So Suzanne, let's talk about like, what are some situations that you hear clients call in? Like, why would you consider switching from a supplement? Let's go supplement to Advantage plan. So why do you think, what's your experience with people considering that? What are the reasons?
Okay, so here's a perfect example. So I've had clients that, turn 65 and they're like, hey, I'm going to travel the world. The lady I talked to this morning, she said, one of my sons is in Washington, the state of Washington, and one is in New York, the state of New York. And I said, wow, completely separate coast. With that being said, she said, we do a lot of traveling. So we want to make sure that no matter where we're at, we can see any doctor, any hospital that takes Medicare, because we don't want to be like, oh, well, does this one take my plan? Am I in network? Am I out of network? So instantly she said, I want a supplemental because of that. So someone might come to me at 65 or 70 when they retire and they say, I want a Medicare supplement because I want the flexibility. I want to travel. I want to see the world or see the country, see my friends, etc. And they want that flexibility. Well, remember, I told you as you age, unfortunately, the rates go up. So if you come to me at 65 years old and I tell you, okay, you can do a supplement, it's 100 and let's just say $150. Well, by the time you're 85 or 80, 85, that premium might be somewhere in the $200 range for at that point. And you might be like, okay, well, now I'm to the point I'm really not traveling outside of maybe Columbus, Ohio. I'm not traveling outside of my county. So you might say, well, my income, I don't really have the money, or I'm not willing to pay, or I can't afford for a Medicare supplement because the rates, remember, have gone up. So you might come back and say, okay, you know what? The rates are kind of too expensive for me. I really like the coverage, but I really want to try the Medicare Advantage for 1 year. And we might do that trial period. And you're coming to me and saying, I don't really travel. I'm willing to stay in the network. So I'm willing to take the risk of saying with an HMO, and it'd be maybe $3,500 or $4,500 max out of pocket. That's where I see people that are leaving their Medicare supplement, moving, as I would call it, going down the ladder. They're leaving their supplemental and going down to a Medicare Advantage and saying, I'm willing to accept that liability because my premiums are now very, very high. So that's a situation. I mean, I have had clients that have definitely done it and they're happy with it because the premiums, they may have been paying, $200 and $250 a month, and they're paying that premium every single month. And if they just started saving that premium, and if they had an out-of-pocket cost on a Medicare Advantage, they may have the premiums to pay those copays or pay that out-of-pocket. So that's an example.
So would you say somebody that's in that situation that has a supplement, they've had it for a few years and are considering moving to an Advantage plan, that it would be more financially driven, like, hey, I'm trying to save money, that type of situation?
Generally, it is more financially driven, and it's to the point they're like, my premiums are just so high, I need that break on my premiums, and I'm willing to pay copays or pay doctor copays or pay hospital charges, because you can always, not that I can endorse it, but you can always contact a hospital and say, I'll pay you $25 or $100 a month if you ended up having a bad situation and having a big hospital bill.
So in that situation where somebody's on a supplement, think about an Advantage plan, like, are there any other internal factors that they should really consider with how their service will be provided? For example, prior authorizations or something like that they're not used to with a supplement?
So some Medicare Advantage plans do require prior authorizations. So with that being said, before you, let's say, for example, if you're on a supplemental insurance and you want to go to a specialist. So you wake up one day and you're like, man, my sugar diabetes is really high, or my sugar is really high. I need to go over and see an endocrinologist, for example. With a Medicare supplement, you can just make that call. You don't have to have a referral, so to speak. With some of the Medicare Advantage plan, not all, but some Medicare Advantage plans require a referral. So you would have to go to your primary care and say, hey, I think my sugar seems high or something like that. I need to go see somebody that can help me. Some of those plans require a referral to go to a specialist. So that's some things that you definitely want to think about. If you're leaving your supplemental insurance, going to an Advantage plan, is the Advantage plan that you're going to, do they require a referral in order for you to go see a specialist?
That's good. So are there any other factors? So say somebody's been on a supplement for 5 years, maybe 10 years, and it's just the premiums go up every year. It's just how it works. What are there any other factors that might be a shock to them once they switch to an Advantage plan that they're not used to because they've had the Advantage all those years, or the supplement all those years?
Yeah, let me give an example of something that's just happened this past open enrollment. So remember, I told you that Medicare Advantage plans have networks of doctors and hospitals. So there was a hospital network here in Muskingum County. And Genesis, it's no secret, it's all over the news. Genesis Healthcare Hospital decided anybody that had the Humana or the Anthem Medicare Advantage plan, not the supplement, the Advantage plan, they had to change plans because Genesis Hospital was no longer going to accept Humana or Anthem Advantage. So if you are somebody that's used to a supplement, used to not worrying about networks, and you change to an Advantage, and we move you to an Advantage, and we check all your doctors and we say, hey, your doctors are all in the network, go ahead and do this Advantage. Remember, doctors have the right, or hospitals have the right to pull out of that network. So maybe the next year, when we, look at your plan, we might have to say, look, if you want to still go to your certain doctor, you still want to go to a specific hospital, we need to change your plan, because Advantage plans have contracted hospitals and doctors, and a doctor can choose, or a hospital can choose, not to recontract with that specific insurance company. So that's something that you would definitely want to think about, because if you want to keep the same plan, you might have to change doctors. Some people don't like changing doctors, so then we have to change your plan.
Okay, that's good. I think that's a good heads up for anybody that's been on a supplement and they're thinking about changing to an Advantage. And if you're out there and you're on a supplement and you've been considering an Advantage and you're watching this live and you have any other questions you think or concerns that you think we're missing, please put them in the chat so we can answer them here before we wrap this up. And then if you're watching us later on video, please put in the comments or reach out to our office if you have any questions about that. So let's reverse it here and say, for those that are on an Advantage plan and they're thinking about moving to a supplement, what do they need to consider? What are the pros and cons of that? And take it from there.
Okay, so if you're on an Advantage plan currently, remember that you have 12 months from your Part A effective date. So one might say, well, Suzanne, how do I know about my Part A effective date? Well, look at your Medicare card. It's going to look just like this. Well, it won't say sample across it, but it will look at your Medicare card, and you're going to have your Part A, and it'll have a date. Okay, that's when your Part A of Medicare started. Okay, as long as you've been on an Advantage plan less than 12 months from your Part A date, and you want to go to a Medicare supplement, we can do that without any pre-existing conditions. So even if your doctor just said, hey, you need a knee replaced, as long as you're within that 12-month period, we can move you up to a supplement without having to worry about that. That's something you need to think about. If you're thinking about moving from a Medicare Advantage plan to a Medicare supplement and you're past that 12 months, you have to medically qualify. So you might look at it and say, you know what, like I had a client a while back call me up and she said, hey, I know I'm past the 12 months. And she'd been on Medicare for a few years. I think she was 68, I think is the age she was. And she said, but I'm still super healthy. But I know as I'm aging that I'm a little concerned that I'm going to have some health issues down the road. It was more like she wanted that peace of mind, security. And she said, but right now I'm healthy. And I said, okay, well, then if you want to go ahead and move to a supplemental insurance, we can do that. You just have to answer medical questions. The insurance company is going to pull your medical records, and then they're going to decide either yes, we'll take you, or no, we will not, or yes, we'll take you and we'll rate you up. It just depends. And so she wanted the more of the security of, hey, I'm still fairly healthy. I don't really have any big problems, but I want to lock in my insurability for when I get older and money is not necessarily a big issue to her. And she said, I'm able to pay as the rates go up. But from 65 to 68, because she was healthy, she said, I really don't need it. I'll take the Medicare Advantage. And if I have a bad year, so what? I've got the money to pay for it. But by 68, she wanted that peace of mind. I'm still healthy. Let me go ahead and get the supplement when I can. Now, there are certain rules as in timing. You can't just do it whenever. There are certain rules. So if you're in that, where you're thinking about moving to a supplement, give us a call because we got to make sure that it makes sense based on the timing.
Okay, that's good. So Suzanne, the $1 million question for everybody on the call that is either in a supplement or in an Advantage plan and thinking about switching one to the other, or somebody that is maybe just retiring and wondering where to start at. Like, is it ever smart to move from one to another?
That's $1 million question, and I'm not even sure I have $1 million answer because it depends on your situation. I mean, I had a client that they started with me at Medicare Advantage at 65 years old. And he wasn't even 66 yet. He was 60, I think, he was in that first 12 months. When I met with him, he was as healthy as could be. He had zero problems. And he called me 6 months later and he said, I was just diagnosed with cancer. And I really want to move to that supplement. Is there any way it's possible? And I said, thankfully, you're within your 12-month period. Let me move you up. And I was able to move him up to the supplemental, and it started the first of the next month. And he was able to have, his cancer treatments under the supplemental. I would say that was a great success story of using that trial period. Now, I've had other clients that were with a Medicare supplement. They dropped their supplement because of the cost. They went to Advantage. They had a couple of great years on a Medicare Advantage. And then all of a sudden they got diagnosed with something more catastrophic, heart disease. And what I found is, unfortunately, when they had their treatments and they had the heart attack, the open heart surgery, unfortunately, they had to pay, with the Medicare Advantage, the out-of-pocket cost. And then I could not get them back on a supplemental again for a decent rate because they had now a pre-existing that I had to bring into the equation. And I get the statement. I wish I could count how many times I get it. Well, Suzanne, I thought with Obamacare, all Medicare or all pre-existing conditions go away. Well, that's not the case once you go on Medicare. There's certain rules and certain guidelines that we have to follow, that the insurance company follow when it does come to pre-existing.
Okay, that's good. So we had another question come in that I want you to answer real quick that was kind of not related. Says, how is your Medicare paid for if you're not drawing Social Security yet?
Okay, if you're not drawing Social Security, you are billed generally on a quarterly cycle from the federal government. So I have seen it to where they try to get you on a quarterly cycle. So I've seen it before where someone's got a bill and it really was for 5 months. Because let's just say, for example, you started in March. So I saw the bill for like March or February, March, April, May, June, because they wanted to then get you on a quarterly cycle. So if you're not drawing Social Security, you are billed from the federal government. Make sure you pay that bill, because if you don't pay it and your Part B gets canceled, you have a whole nother set of issues, because then that's when your Part B penalty starts accruing. And of course, you're not going to have coverage, the right kind of coverage. Now, if you are somebody not drawing Social Security and you want to, and you get the quarterly bill, you can set up, it's called Easy Pay through the website, and you can set up to where they eventually start deducting out of your checking account on a monthly basis until you start drawing that Social Security, where they pull it out. Now, from experience, when I I'll just tell you, I helped my dad set up his auto Easy Pay come out of his checking account. It took about 3 months. So we went ahead and paid the quarter, set him up, and then eventually it started working. And then once you start drawing, it switches over automatically to start drawing from your Social Security check.
Okay, good stuff. So one last thing before we wrap it up here, we had somebody that asked a question to kind of recap what we were talking about at the beginning about the live event. So May 2nd, Thursday, May 2nd from 11 a.m. to 3 p.m. We're doing a live event. It's going to be at the Villa Milano. We put the link in the chat here. So if you click on that link, it has all the details and the agenda of everything we're going to cover. The title of the event is How to Add 7 Years to Your Life Without a Gym Membership. And we're bringing in a nationally known speaker and author, Richard Leiter, and he's going to be our keynote speaker. And then we're going to hear from Suzanne. It's not going to be as heavy content as we heard today. It's going to be a little bit lighter. and more fun. So we try to make these entertaining and helpful, these events, and we're serving a great lunch, and the tickets are only $10, which we basically just charge $10 just for the people that say they're going to show up will actually show up. So get your ticket to the event, bring all your friends to the event. So we're already paying for the room and the event and the speaker. So we want to fill that room up and help as many people as possible. So the link to the event is in the chat, and we're going to email this video out to everybody, and we'll put the link in the email. And actually the email to this Zoom, in the PS line, it had the link to the event, so you can find it there too. So
Hey,
that
before we wrap up, if you have any friends that would like to get a copy of our book here, Navigating the Medicare Maze, we would love to send this to them, because basically what this book is, and I'm sure many of you have received it and read it, and hopefully you've passed it on, because that's how we build our business, is the stories are really stories from each of our clients that are real life stories, really kind of helps other people while they're going through the Medicare process of understanding. Of course, I talk in the book here about the difference between Medicare Advantage and Medicare Supplement. So feel free, have your friends call our office, and we'll be more than happy to send them a copy of our book.
Yeah, we also just put the link to get the book in the chat here. So if you want to click on that, you can fill out your address or your friend's address, and we'll mail it to them. And Suzanne made a good point. Like, we're really bad at asking you to recommend us to our friends, but that's how we grow our business. And that's how we're able to give you guys great content and host these live events, is we want to help more people. So any friends you have, anybody you think that you think we could help with their Medicare, anybody retiring, we definitely want to help them. That's the easy first step is for us to send out the book, because it's so helpful to people that are brand new. So thank you so much for being here today. Suzanne, you get the last word.
Once again, I love spending time with you. I love to talk and teach. I love to see everybody. And I'm hopeful that everybody shows up at our event in May, because I love to shake hands and hug people. So come on our way. Talk to you soon.